Hey guys, it's Dr. Tom with EBM Fitness Solutions, and in this video we're going to look at shoulder pain, limited shoulder range of motion, some ways to assess whether it's the joint versus muscle, and then ways you can start working on getting that range of motion back in a pain-free manner. So one of the first things that we need to figure out is it a restricted shoulder joint, or is it more of the muscles around it that are causing you to have difficulty lifting the arm up or out to the side? One of the ways we can do that is with some assisted range of motion. I'm going to show you a couple options here using the pulleys. You can also use bands, and you can also use a dowel or any kind of a hockey stick, an umbrella, you name it, a baseball bat, anything that kind of helps to push the arm up, both as an assessment to figure out what's going on, and then we can also use that as initial treatment if it warrants that. So first thing, when we look at assisted range of motion, if you have trouble lifting your arm on your own, it gets stuck somewhere here or it's painful, same thing out to the side, and we do the assisted motion and it's normal and it comes up and there's little to no pain or less pain, usually in that case the joint's not the issue. It's some combination of some muscular stuff and some other things, but your joint has the physical ability to actually go where you want it to go. So that gives us some good information as to what things you can do going forward. Now, you lift here on your own, you hook up to the pulley thing, boom, it still stops here. This will not help you. You'll need to either go see somebody, physical therapist, doctor, chiropractor, somebody. You'll have to get some additional treatments because this will not work for you at this time. This is going to work best for somebody who actively or on their own can't lift, but with assistance, the arm goes up to pretty much a normal range of motion. So if that fits your description, then check out these next two videos, and then we'll see if we can't get you back on track. The first motion we're going to look at is shoulder flexion, and that's just the act of bringing your arm straight up and down this way. So if you have a difficult time lifting the arm up on your own in that flexion pattern, we can try this assisted flexion motion to see what happens to the shoulder. Does it help with your pain? Does it allow you to go through greater range of motion? And here's what we do. We're using the weight to assist the motion, not resist it. So let the weight lift the arm up. So what I'm going to do is I'm just going to keep my elbow slightly bent, and I'm going to let the weight lift my arm up. Now at this point we have a few different options for getting the arm back down. You can try this, which if your shoulder hurts, it's probably not going to work, okay? So the key is relax the arm, let it come up. The second option is to reach up and pull it back down with both arms. Okay? Third option, again, relax, let it come up, is to bend the elbow, bring it down, then use both hands to reset, and then to bring the weight back up again, down. That's going to be the easiest one. And if your shoulder hurts, remember one of the things you want to always do is reduce or eliminate irritating factors. So this should be a pain-free motion or very, very low level pain. If you look at the 0 to 10 pain scale, like 2 or 3 out of 10, it's got to stay way down that end. If it creeps up, then again, this option may not be the best for you at this time. So if you have some limited shoulder flexion actively, but this does help you get that range of motion, it also helps to limit your pain, this would be a good treatment option to start with right away. Next, we're going to look at shoulder abduction, which is bringing the arm out to the side this way. So again, if you have difficulty doing that range of motion, we're going to assess it and then potentially use this as a form of the initial treatment. Now, a common mistake that people make when doing this is they do something like this. They set up this way and they lift up here. Now the problem is, the setup here limits your ability to go any further than this. So this setup is incorrect. Don't set up this way because you're only going to get to about this point, unless you try to move in here, but then it gets really messy that way. So an easier solution is when you set up with the arm you want to work away. Because now, from here, this brings me up. Now I have the same options with flexion. I can pull back down this way, which is probably not the best option, to be honest with you. Come up this way, use 2 hands to pull down that way. Again, the third option, which is probably the best option, is let it come up, bend the elbow, bring it back down close, and then use both arms to reset, and then let the arm come up that way. With abduction, make sure you're aware of where the arm is in relation to kind of the shoulder and the head. Don't put it way behind. You'll limit your own range of motion, and you'll probably irritate whatever symptoms are currently going on. But don't let it drift too far in front either, because that's not the abduction pattern we want. We want it to be here, so it's in line with more so the ear, the cheek, right in that area. So a little bit of movement is okay, but if it ends up being way out in front, no, then your shoulder has some other issues. Again, this may not be the best option for you at this time. But if it's limited actively when you lift it, but it improves with the pulley or the band or whatever else you're using, then this is a great assessment to preserve range of motion, to kind of manage symptoms, keep the pain down, and then start to work on a little bit of that, because you are strengthening the shoulder a little bit when you do these motions. So start with this, see how it feels, as long as the pain is low. Remember, 2 to 3 out of 10 on that pain scale. It's got to stay low. If you fit all of that criteria where the motion improves, pain stays low, this is something you can utilize as part of the initial treatments to help kind of get your range of motion back, manage your pain, and then transition into more challenging shoulder exercises.